What was I going to cover today? Jess? What's that? Thanks, Jess. Let's see, what's this? What are we going to cover today? Right. We're going to be looking at how you can prepare for your respiratory placement. Okay, so today we are looking at preparing for your respiratory placement. Now, I'm covering this from my personal point of view, my tips from having just come off my respiratory placement, and I wanted to go through some things that I did do and some of the things I kind of wish I'd done more of or didn't do at all, and share those with you so you can kind of benefit from my experience, which should be what we all do as physios and students. So today is going to cover two separate sections really. I'm going to cover my tips and tricks from a point of view of an A, B, C, D, E and F, a sort of systematic approach to preparing, if you like. And then I'm going to finally look at the Twitter post that I did on the 7th of August, which had some great responses from some very experienced and qualified respiratory physios and physios all around. So I thought I'd share some of those with you, and I will also link that as well. So just to begin with, okay, so popping up now should be the A, B, C, D, E and F. So that'll pop up. So we are covering assessment, some basics in terms of your normal values, conditions. We're coming to discharge. We're then doing our evidence and treatment effects, linking those two. And then the last one is fun. So starting off straight away, first things first is contacting your educator, the placement team, to find out what specific setting you're going to be in and what they recommend you do prior to placement. And obviously this trumps anything that I go through today, as does anything that your university recommend, I'd hasten to add. But particularly from your educator, because they will know their setting inside out. They'll know the conditions that they see most regularly. They'll also have in their mind their expectations of you, depending on what year you're in. And also they will potentially give you some ideas on preparatory reading, sort of having a look at maybe some journals or articles, textbooks they recommend, things like that. So take your first tip from your educator. They are the ones in the know, and contact them well nicely in advance, whatever's recommended by your university, and sort of agreed with them. Certainly don't leave it to the last minute. So that's kind of tip number one, out sort of kind of obvious, but do make sure you do that. So kicking off the A, B, C, D, E and F that I've sort of put together. First one is assessment. This is absolutely key, and it's something that I was a little bit blasé on when I went into my placement. I thought my respiratory assessment was absolutely spot on, but it wasn't as good as it could have been, and I had to work on that for the first few days. Now, if any of you do OSCE or ISPE practical exams and you've had a respiratory one and you've prepared for your assessment on that, you've probably really got it sorted in terms of that you're going to be under pressure, you're going to be nervous, stressed, different environment. So just take that same approach to placement, because on placement it's going to be a very new environment. You're going to be working with people you don't know for the first few days. It's going to be out of your comfort zone. All those things mean that anything that you've learnt could go a bit shaky. So just really make sure that your respiratory assessment is really honed in, and that you can do it sort of almost with your eyes closed. Practice at home, practice with friends and family, and just make sure that you've got that sorted. Next one is basics. This is two-pronged, I suppose, really, is do the basics well. Don't think about starting to push into sort of all your evidence and stuff like that until you've got your basics. So at university, we're always told about the cake. Make sure you've got your sponges, your basics. Without that, you haven't got a cake. So make sure those are really, really good. Once you've done that, you can then start putting on the icing, which is your evidence. So have a look at that. And then your cherry on the cake is your critique, your appraisal of that evidence. It's saying this evidence is good because of, but it falls down because of this. So that's kind of how you should layer it, and do stick to those basics. The other one is OBS. So you see how I got the B in there, but get your normal values dialed in. And that doesn't have to be every single observation that you could potentially come across, but it does need to be your basic ones that might tailor what you do with the patient. So particularly things around respiratory, obviously, this respiratory rate, your saturations, your ABGs, make sure you've got those really dialed in. Although when you're looking at blood gases, they usually have the normal values, which are sometimes slightly different to what you've learned, but they're pretty much in the same range. But also things like blood pressures and MAP, your mean arterial pressure, things like that, heart rates, all those basics that you do early on in your course, but just make sure that they are there, because some of those will affect what you do. They're things that, particularly in ICU, you're very aware of all the time. They're really good indicators as to what your treatment's doing, and also whether or not you should be doing anything with that patient. C is conditions. So again, your educator may well give you an idea of what conditions that they see on a regular basis and that they'd like you to be really familiar with. But particularly, obviously, your respiratory conditions, COPD, bronchiectasis, asthma, things like that. But also, your respiratory might be on a CF ward. So that means you kind of, hopefully is obvious what you should be looking at there. But if you're not so specifically working, say, CF, but think about your surgeries. So think of your laparotomies. Think of how and why they might pose a risk to a patient from a respiratory point of view. Why might you be getting involved? And I would say that on my placement over the 5 weeks, I'd say the majority of patients that I saw, by about 60% of them, I'd say anyway, were post-op laparotomy, so sort of gastrosurgery. So have a look at that. Don't get massively in depth with it, but just think of it in terms of why might that surgery have an impact on a patient from a respiratory point of view. What am I going to be doing with that patient that might facilitate reducing risk to respiratory or helping them in any way? So then I go on to D for discharge. Discharge for me was a big thing on placement, and I'd say this probably is more relevant in your second and third year, but it's not to say it's not in your first year. But when you've got a patient, having discharge in your back of your mind is pretty important, because I found that without that, you'd quickly find yourself with a patient that's been made medically fit, and then you're a bit lastminute.com on whether they're therapy fit and what needs to happen for them to go home safely or elsewhere, what is right for them. So having those conversations with them, their family earlier on, knowing their baseline, knowing your patient is absolutely critical. So what is it that their baseline, how were they before they came in, what A's did they use, what have they had since they've come in hospital, what's a realistic sort of go forward approach with that patient. So have a look at that and have that in your mind. Talk to your educator about the discharge processes. If you don't know all of the pathways and things to discharge, that's absolutely fine. But early on, say to your educator, I've got a patient who I feel may be medically fit in 7-10 days or whatever it might be, and I want to start planning for a discharge. Can you talk to me about the discharge processes? And they will love that, because you're thinking ahead. You're thinking already about what you're needing to do with that patient. Who else you might need to bring in? Think of occupational therapy. Think of the discharge team. Think of anyone else. Think of outpatient appointments that you might want your patient to come in on. Think of the respiratory specialist nurses, the outpatient respiratory physios, anything like that might help your patient going forward is key, and it's good to do. So E is for, so again, kind of package two things here. So you've got your evidence, particularly when you're going into your third year. It's essential, especially if you're looking for those the 2-1 firsts. Evidence is absolutely critical in terms of knowing your treatment and what evidence is backing up your treatment. How good is that evidence? If it's not so good, why are you still doing that treatment? What's your rationale? Obviously, clinical reasoning should underpin first and foremost what you're doing with your patient, but they will start to expect evidence and appraisal of evidence. Talk to your educator, tell them what you're doing, tell them what you've read, have discussions about it, send them an email with a paper you've read, and then talk to them about what you thought of that paper. Really is, communication's key. I didn't do this enough on placement, so I think it's absolutely vital that, you know, I read a lot of research. I was really kind of aware of the research. I knew why I was doing what I was doing because of research, but I didn't talk enough to my educator earlier on, so I had to really kind of fill in later on my placement. Obviously, that is much more appropriate or much more relevant in your third year particularly, but still higher marks you need that evidence even earlier on. So as well as evidence, I've got treatment effects. Know the effect of your treatment. So it's all very well having a patient and mobilizing them, but why are you doing that? What is the effect to that patient on their condition, on their presentation of you mobilizing them? So think about that. Think about positioning. Think about your manual treatments. Think about your ABCDE. Think about things that you're going to do, and not just because you've read it somewhere or because you think it might work, but you know that it will increase FRC and therefore what will it do for your patient and why? Think of the physiological effects on that. All will have been covered in your respiratory modules, I'm sure, but just get that back in the forefront of your mind is key. Then the last one is fun. Placement, it should be, we all started university to do physiotherapy because we love physiotherapy, hopefully. So remember that when you're on placement and try and enjoy it. Get to know the team that you're in and try and have fun. I found on all of my placements that the teams are brilliant. You can't do this job without having a bit of a sense of humour. You can't do it without having some stopping occasionally and having a chat about something, or whether it be a patient or what. But try and enjoy placement. Put a smile on your face. The more you're enjoying it, the better you'll do. The better your patients will do. It's the same with the things. If your patient sees that you enjoy your job, that you're passionate about your job, they will buy in better. They'll be more, they'll be more confident in you. So do enjoy it. It's a stressful sort of time while we're on placement. There's a lot of pressure on us, but it should, at the end of the day, there should be a lot of it that's good fun to do. And if it's not, reflect on it. What is happening that is meaning that you're not enjoying it? Do video reflections. Write them down, talk to friends, family, talk to your educator about what's sort of making it not so fun. People are there to help you and support you on placement, so use them. It's really, really important. Okay, so I'm going to move on now just to a tweet I did. I'm going to try and do a video shot of this and scroll down for this video, so hopefully that will come up whilst I'm talking. So if it doesn't, I'll put it at the end. So I put out a tweet on the 7th of August, and you can go and have a look at this. If you find me on Twitter, I'm on @PhysioArmstrong. And on the 7th of August, I put out a tweet. It just said, okay, it's helped the physio student time. What are your top tips for preparing and getting the most from a third year cardiorespiratory placement? I want to arrive ready to get as much as I can from the placement and also be a useful member of the MDT. #respiratory, #physio, #placement. So I had a massive response from this, and it was brilliant. And so I thought I'd go through a few of these now. Time-wise, I think I'm okay. So a few things there. Review your module workbooks, your lectures and things like that. They'll cover the most common conditions and basic assessment. And then again, like I've said, talk to your clinical lead and the educator. They'll be telling you. So that's from Angie Logan. And she's one of the co-chairs of the CSP Southwest Regional Network. And that was brilliant. And then a newly qualified Band 5, Carol Hunter, she said, she pointed me the direction of the ACPRC, and that's one of the CSP bodies or networks for respiratory. So then we had Amber Roberts: read notes thoroughly, ask questions, contribute to the board rounds. Everyone values your input, and I will definitely second that. On placement, I was astounded by the level consultants asking for my opinion, knowing that I was a student. You are really quite valued. Joining them in joint MDT sessions, and don't bog yourself down with loads of info before you learn to go. So that's an interesting point from Amber there. So I'm telling you how to prepare, but don't bog yourself down massively. Again, go back to the B and keep to the basics. Listen to what the educators have to say. They are, and this is from Morgan Williams, they are a fountain of knowledge, and that's very true. When you look at your educators and potentially the team around you, you'll have decades of experience. And that's from Morgan Williams, qualified physio. Helpful to read ABGs and X-rays, physiology behind common respiratory treatments. Defo, take a notebook and ask questions. Okay, so this one here, this is from Physio Tutorium. They said there's a long article that clinical educators expect from students. Do pre-placement reading, show your knowledge, ask questions, show initiative, really important, take up opportunities, ask for opportunities. Look for ways to help with audit. I think some universities do have that in their marking criteria about contributing to audits, data collection, etc. Do the in-service training, share with the in-service training. That could be one of your presentations, and share your lit reviews. Again, that evidence. So if you follow this here, Tracy Daniels has put a link to a document here, which is a really good paper I'd recommend to have a look at that. It's a clinical lead with people with cystic fibrosis. So again, these are people on Twitter coming back to me who are fantastic fountains of knowledge. Try and observe speech and language therapy. This comes from Jen Murphy, who is an ENT and respiratory speech and language therapist in Newcastle. They work with upper airway disorders and help differentiate between dysfunctional breathing and laryngeal disorders, notably inducible laryngeal obstruction. You might even get to see your own voice box if they have time to scope. I didn't, but I did work with some of the SALT team. Lizzie Grillo, all the above points. So she's a respiratory physiotherapist and NIHR trainee, so getting into research there, which is fantastic. So she was saying about remember to ask patients how it feels to be breathless or struggling with recovery. This will give you an awesome insight and will enrich how you approach your problem lists. Also, make sure you see acute patients to prepare for on-call. And that's something actually is a really good point. Get on-call experience if you can. So let's have a look at my time. Okay, good. So that's some really good ones there from Lizzie there. I think talking to your patients about how it feels for them, because that's, at the end of the day, that's what's really important, is how are they feeling, what are their concerns, their worries. Again, I talked about this in another video about compassion. Remember where that patient's come from. They're in hospital, they could be incredibly scared, anxious, apprehensive. Even as a first year student, you already have probably far more knowledge and understanding of conditions than your patients do, potentially. So that knowledge comes understanding, which eases anxiety. So if you didn't have all of that and you were in their situation, how would you feel? So just always kind of have that in the back of your mind. And then, get on call. If you can, talk to your educator about coming on call, especially if you're in your third year. I did it, and it really has eased my apprehension about going on call next year. So this one comes from Lee Carter, who's a specialist paediatric physiotherapist in cardiac ICU. So write down a systematic respiratory assessment, subjective and objective, in a notebook to refer back to. You can always look at it mid-assessment. Just let the patient know you want to be thorough as possible. Brilliant tip there from Lee Carter, because we are students at the end of the day. writing stuff down, referring back to it is far better than trying to do it off the top of your head and falling short. No patient or no educator is ever going to mark you down for being thorough in having your notebook with you. That isn't, think of infection control, but other than that, it's great. I was doing a lot of SBAR with my patients, so I'd go and do prioritise the ward, and I'd come back to my educator with a sort of rundown of the patients, and I'd use my notebook. I couldn't remember 10 patients, why they'd been admitted, their backgrounds and their previous medical history off the top of my head. So moving on to Liv James, do some pre-reading on the area and take every chance you can to see different things. Ask lots of questions. We honestly don't mind, and enjoy it. It's the best. So Liv James sounds like she might be an educator. Critical care physio in Bristol with a passion for ICU rehab. So really good points there. So again, pre-reading on the area based on what your educator's told you probably. Take chances, do different things, ask lots of questions, and that's coming through massively. Is if you don't ask questions, how will you ever learn? So I think it's something that I've been picked up on as a good thing, is how many questions I ask of everyone, not just your educator. Liz Cowan, she's independent children's physio, says follow at RMCH_physio on Twitter and others alike. Inform your practice and give you tips for learning. And then this is a good one here, I think. Don't try and do what you don't know what to do. Stay safe. Keep within what you're comfortable with. And if you're not, say, and your educators will like that. They'll have confidence in you. They'll probably give you more freedom as a student physio if you say when you don't know something or you're not sure how to do something, because then that gives them confidence that you're not going to go ahead and do something with a patient that you're not familiar with or you don't know. So, and I've been praised for that many times of being sort of, if I'm unsure, checking. This is a really good one. So Harriet Shannon, so physiotherapist, teaches at UCL, supporter of creative learning. Keep a notebook and write down the words you don't understand so you can Google them in the evenings. Just be your relaxed, inquisitive self and they will all love you. So again, two things there. Keep a notebook and write down words. What I do is my notebook I have at the back, I put a glossary and I write down any terms that I'm not sure of. I can then check them at lunch or any breaks, all there and then if you've got time, and certainly evenings. And you then create yourself a really nice glossary of terms for that placement, which is fab. And you could then share them. And then be relaxed and inquisitive. Ask questions, show that you're really keen to understand what's going on and you're really enthusiastic. Emma Singwood, who is a respiratory pathway lead physiotherapist, vice chair of the ACPRC. So this is some of the people that we get coming through on Twitter, which is amazing. So she says enjoy it, ask questions, get stuck in, spend time with the MDT, definitely second that. Pre-reading on basic respiratory assessment, ABGs, common conditions, operations, presentations relevant to the area, useful so you can get to learn even more. And she says, did I mention ask questions and enjoy? So we're all singing from the same hymn sheet here. Valerie Murray, she is a Galloway girl in Dublin, physiotherapist, acupuncturist, special interest in hand and upper limb. See, we all cover respiratory. Listen to the patient's anxieties and worries. Again, we've said this before. Being in a hospital is your everyday life, but not every day for your patient. Any meds, comorbidities, etc. you come across that you're not familiar with, write down and look up. Good luck. Again, thinking from a patient point of view. Joanne Finn, be kind to patients and colleagues. Ask what matters to you. Set goals your patients want to achieve. Help them own their healthcare. Seek answers from everywhere and everyone and enjoy it. Good. Same sorts of thing there. Charlotte Chu is paediatric physiotherapist working in the at RMCH physio team. So that's the silent part of Choose Health. So that's fantastic. All part of the Physio Matters podcast. So she says, make sure you understand the normal mechanics of breathing. Again, these basic mechanics of breathing. It makes much more sense than when the patients are struggling, and easier to get the differences compared to mechanical ventilation. That's really important actually. When you see a patient ventilated, understanding what normal breathing is and what a ventilated patient will be receiving is quite important in terms of what you might be treating. Caroline Evans, clinical lead cardiac physiotherapist, so critical care, and she's talking about here, so spend time with other MDT members, working a nurse shift, going to theatre, pre-op, cardiac rehab, master the basics of respiratory assessments, know the rationale behind your treatment. Patients may have the same incisions, but physiology is very different. Read, ask and enjoy. That's some really good tips there from Caroline, actually. And then this one is from Ray Lloyd, who is a third-year physiotherapy student at Coventry University. A really good tip here, just very short. Be kind to your nurses. I definitely second that. I'd also just add in there the HCAs, because they, as combined, will know your patients really well. They'll be spending the most time with them, and also have a huge amount of knowledge. If you're working on a respiratory ward, especially ICU, they'll have a fantastic knowledge. Every day you go in, you'll be asking them for an update on how things are. They'll be able to tell you in outstanding detail. So this is a good one here. This is from Jacob, physiotherapist at the Bendigo Health Care Group, I think that is, and it just says clarify with your supervisor their expectations of evidence-based practice and what they expect from you in this area. That's really quite a good one. So we mentioned in the ABCDEF, the E for evidence, talking to your supervisor about their expectations for evidence-based practice. That's a really good one, because then you can pitch yourself at what their expectations are. I'd say that goes with everything, actually. I think what Jacob's saying there is kind of, it's generalizable to everything that you're going to go on placement. Get an idea of what your expectations with your supervisor, what their expectations are, and that should come with your goal setting right at the beginning when you do your placement. Sit down with your educator. What are their expectations, but what are your expectations on yourself? And come up with those clear goals. Review them regularly. I didn't do this enough on placement. Sit down at the end of the week. Review, how are you doing compared to your goals? Where do you need to go for next? That should form part of your reflections as well, but talk to your educator about it. So I think I've covered all of those there. Have a look at it. Follow me on Twitter, find it, or don't follow me on Twitter, just find it. 7th of August that went up. Some really good tips and tricks there. I think they all kind of repeat, which is a good thing. It means that there's some continuity there. And that's coming from students, educators, clinical leads, band 5s. It's coming from a whole variety of respiratory specialists, non-respiratory specialists. Bear in mind that if they're working in the NHS, they still will have done their rotations in respiratory, but we're all physios at the end of the day. I think most importantly, enjoy placement. Use it as a learning experience. Your marks, of course, are important, but they will come from just enjoying and working hard on placement regardless. So I think that's everything. Hopefully that will have helped. It's a bit of a longer one today, but I think it was needed. Enjoy your placements wherever they are, and we'll see you again soon.